uses. So welcome.
Good afternoon, everyone, and thank you for the opportunity today. So my name is Benny Papanet, and I'm going to be presenting on Dexcom. So the title of the research is Dexcom Continuous Glucose Monitoring Device Improves Hypoglycemic Awareness and Quality of Life in People with Type 1 Diabetes, a qualitative cross-sectional analysis. So firstly, what is Dexcom? Dexcom is a continuous glucose monitoring device which people with diabetes use to monitor blood glucose levels without the use of cumbersome finger pricking. How does it work? So firstly, the sensor is inserted via applicator to the skin to allow for 24-hour monitoring. And then blood glucose levels are wirelessly transferred to the user's phone. Now, if you go to a database and search Dexcom, you'll find that the evidence look at the effectiveness rather than quality of life. So looking at the study from Satish, you can see it's entitled The Accuracy and Safety of Dexcom. Another study, The Long-Term Cost Effectiveness of Dexcom. The Accuracy of Dexcom in Non-Critically Ill Hospitalized Patients with Diabetes. Another study saying G6 Continuous Glucose Monitoring System feature use and its association with glycemia in Europe. So you can see that there's a trend where there's very little to no research looking at the qualitative side and the subjective experiences of users using the Dexcom. And this is where we wanted to fill the gap. We wanted to look at disease and life, so quality of life. And this is where we developed the aim of our study, which is to assess the impact of Dexcom usage on quality of life in patients with type 1 diabetes in Sligo University Hospital. So it was a single center cross-sectional study, which occurred from September 2022 to September 2023. And the inclusion criteria consisted of people with type 1 diabetes using Dexcom device for at least 6 months. A patient information leaflet was given and consent was obtained. Quality of life questionnaire was offered to patients attending outpatient clinics. And of course, we obtained ethics approval from the ethics committee. So this is just a small snippet of the questionnaire, which part one contained open-ended questions where we got patient demographics. We also asked them if they would recommend Dexcom to other people with diabetes, and we asked what features they particularly liked about the device and what features they disliked. The second part of the questionnaire consisted of closed-ended questions with a glucose monitoring satisfaction survey. And this consisted of questions which patients rated from 1 to 5, where 1 is strongly disagree and 5 strongly agree. In terms of results for the study, total number of participants were 40. And you can see the majority of participants were male, 67%, and female comprised of 33%. In terms of age ranges, participants range from 18 years of age, 65 plus. However, the majority were in the range of 25 to 34 years of age. So for the ease of the presentation, the following responses have been grouped together as majority of participants either strongly disagreed or disagreed to the questions asked. So you can see from this survey here, where red is strongly disagree, orange is disagree, gray is neutral, and light blue is agree, and dark blue strongly agree. You can see when patients were asked if it's too painful to use, they disagreed. If it took too much time to use, too much of a hassle, if it made them feel more depressed and down, if it often gave them results that didn't make sense, if it caused too many skin irritation or bruises, if it made them worry a lot, if it wasn't as accurate as they would like, and if it made them feel more frustrated with their diabetes. So in summary, majority of participants have disagreed to these responses, suggesting that Dexcom doesn't have a negative impact on users. Again, I've grouped this in terms of agree and strongly agree. And interestingly enough, you can see when asked, does Dexcom help you be more open to new experiences in life? Majority of the participants were quite neutral on this question, so 42% were neutral and 39% agreed. When asked, does Dexcom help you be more spontaneous in life? Collectively, 69% agreed and strongly agreed. However, 28% were quite neutral. Again, participants thought that Dexcom helped them to feel less restricted by diabetes. And when asked, does it make you think about diabetes more than you want to? 28% disagreed, 31% were neutral, and 28% agreed. So we thought that this was really interesting, actually, and due to the scope of the research, we were unable to further expand on those close-ended responses. However, it's something that we could explore in the future by perhaps having small focus groups or individual interviews to really explore what patients meant by these responses. Open-ended questions results. So 100% of participants reported they would recommend Dexcom to other patients with diabetes. 92% reported better impact of quality of life with Dexcom. And features particularly liked was the ability to integrate Dexcom into cars, Fitbit, or watches. The alerts given when glycemic levels were not in range, so hyperglycemic levels or hypoglycemic levels. The lack of finger pricking to determine glycemic levels. And an interesting fun fact is since the introduction of continuous glucose monitoring device, particularly Dexcom, 11 billion finger pricks have been eliminated. And they also like the ability to continuously see their glycemic trends. In terms of features disliked, one particular feature is that Dexcom is not compatible with all phones. However, as we are able to further expand and as they bring out new generations of Dexcom, they are more compatible with phones. Patients dislike false readings at night when lying on the sensor. The sensor often loses connectivity and falls off easily. The inability to lower alarms, which again, this would be defeating the purpose. Some patients thought that Dexcom is not waterproof, so they didn't like that, and the inability to measure ketones. So challenges and limitations of this study. So firstly, it was a small sample size, only 40 participants. However, this research is ongoing, and perhaps in the future, we could also ask these questions in further regional hospitals, in regional hospitals. And in terms of response bias, so due to participants' unconscious desire to respond positively, that could have been one of the elements of response bias. And also, all participants were taught to understand all the questions we have asked. In terms of the impact and research significance, so if we could better understand the positive and constructive experiences of users, this would be really important to inform developments of the treatment. And then these user-identified developments are hypothesized to increase satisfaction and further improve quality of life. Again, with high user satisfaction and quality of life, it is predicted that this will encourage more patients with type 1 diabetes to utilize Dexcom. And more universal usage of Dexcom may overall improve the management of type 1 diabetes and help to ease some of the burden of the illness. So in conclusion, the findings of this study suggest that Dexcom usage greatly improves quality of life along with proven HbA1c benefits. And further improvement of services and features could increase user satisfaction and greater improve quality of life. I'd just like to acknowledge Laura Kiva and Prof. McHugh, who critically reviewed the study proposal. A special thank you to Dr. Elias Eltoum and clinic nurses Maeve Maguire and Rosemary O'Mani, who assisted with the distribution of questionnaires and data gathering. There's no conflict of interest in this research and no funding obtained. Thank you. Any questions?
Any questions for Dr. Papinet? Or will I have to use the chairman's prerogative and ask a question? Yeah, I will use it. Obviously, the period of time that study covered was when people were transitioning from the G6 to the G7. Did you ask specifically what version they were using, and if so, did they give you different results depending on which version they were using?
Yeah. So in the questionnaire, we didn't specifically ask which one they were using, but some participants did say, oh, I'm using the G6 or G7, but the majority of participants in this questionnaire were on the G6. Yeah.
Okay. Any other questions? Anna, please, just at the mic. Okay, I'll repeat it, yeah.
I may have missed this bit, but did you choose Dexcom because that's the one most commonly used in Sligo, or what made you choose that particular device?
Yeah, so that's the one that's most commonly used in Sligo at the moment, so that's why we chose that. A lot of patients as well like Dexcom compared to other continuous glucose monitoring devices such as the Libre.
Okay, great.